Okay, everyone, the part 2 is beginning. We're going to discuss the anatomy and medical terminology. These are two parts that aren't going to take very much time. Really and truly, if you review the information, you go over your study guide, especially with the anatomy portion, you're going to be able to answer most of the questions. There are a few in the anatomy that you may have to reference other parts of the study guide or maybe use Google or one of your coding references. However, most of the 82 questions that you're going to have for the anatomy are going to focus on the diagrams. So the first one, I didn't add every diagram in here because again, you are going to have access to these diagrams once you purchase your study guide, your certification, your membership. So once you get this, you'll be able to open it up and you'll be able to go over the anatomy portion. During your test, you can actually reference these to complete the exam. Because it is a non-proctored exam, remember, you're simply going to review and answer the questions. All right, so the anatomical directional terminology, we have 3 planes. We talk about the coronal, the median, and the sagittal. The coronal breaks it into front and back, anterior, posterior. The median breaks it into halves, and sagittal breaks it into 2 pieces. So median, not necessarily 2 complete halves. It just breaks the body into half. So we can go horizontal, we can go sagittal. Sagittal just breaks it into a right and a left side. Mid-sagittal is completely identical as far as breaking you down, cutting you down the middle of your body. Directional terms. So what direction are we talking about when we are looking at our body systems, what's going on? We have transverse, which is horizontal, lateral, which are the sides, medial, which is going down the middle, superior towards our head, inferior towards our feet, anterior front, posterior back, superficial deals with our structures, the ones closest to our skin, our surface. Deep is more internal, going towards the middle of our body. So the muscles and lower. Distal and proximal is mainly used for limbs, but it is also used for some of the organs when we're talking about, such as kidneys. Is it proximal or distal? So when you're talking about organs, you're talking about the place that it either attaches or is the opening of that particular system. So it's the beginning. Proximal is the beginning, where distal would be where it exits or it attaches to the furthest down that organ system. So every organ system starts and finishes. With our limbs, proximal is what attaches, what's closest to our body, the place of attachment, where distal is the furthest away, such as your fingers are distal to your shoulder. Your anatomical terms, what are they pertaining to? So they're describing where we are located on the body, or they're describing an injury. So it's cervical. We had a cervical strain, meaning we had a strain pertaining to the neck. Normally end with AL or IC, depending on the terms. Our regions are axial, so our axis, which is our skull to our coccyx. Our appendicular is everything that comes off of our axis. So all your bones, your appendages, your hips, those are appendicular. Your body, as you can see, we have our body diagram. So this is a color-coded one, kind of helps you out where you can see where things are located. Body cavities, that's your dorsal, your cranial, your pelvic, your abdominal. You have those diagrams within your chart. There's actually some tables to tell you what's located within those. Body quadrants is your abdominal quadrants. It's going to be your right, your left, your upper, your lower. And within that, it also tells you your quadrants, such what's contained within those. So, for example, your right upper quadrant has your liver, your gallbladder, your right kidney, your duodenum, a portion of the ascending and transverse colons, and small intestine. So those are some of the things that you're going to be looking at. You could have those questions as far as what's included. Other illustrations, you have lots of illustrations in this part of your study guide, and it is to ask questions on what is included. Can you find that area on the diagram? Can you correctly identify that? Because when we're coding, we are looking at the part of the body, the organ system, the tissue type. Do we know where it's located? So that's what this part of the test really tests your skills on. So you have your brain, your ear, your eye, your heart, your different systems, your endocrine, respiratory, the skeletal system. You not only have the skeletal system, but you have individual areas such as your foot, your hand, your arm, your skull, because they're looking at such as your radius and your ulna, your carpals, your tarsals, and then the different bones in your skull. An example of a question that you're going to see, and again, you've got several questions at the end just to help you practice for your certification, but this is one. And it says, using this picture, you're going to select the correct name for the part of the muscle labeled number 5. So when we're looking at it, the first thing you want to do is you want to scroll to see the different areas in the numbers that you're given, the terminology you're given, because you're actually going to break your terms down by knowing medical terminology. Even if you really aren't so sure on the anatomy, the illustrations, you should be able to, by process of elimination, select the right answer. So we have our rectus abdominis. Abdominis is pertaining to the abdominal area. We have our sternocleidomastoid. So that's the process, and it has to do with the process of the sternum, the cleide, which is your clavicle, and your mast, which is your jaw. So in this one particular one, we have our sternum, we have our clavicle, and that muscle that goes up to our jaw. Brachioradialis is pertaining to our arm, our bicep, as well as the radius. So it's the muscle that goes for our bicep to our radius. That's where it's going to insert, is going to be into the radius. Our flexor carpi radialis, it has to do with the carpi is our carpals. Our radial, again, is in our radial area, which is our lower forearm. And orbicularis is going to have to do with the orbital. So looking again at number 5, we find 5 here. 5 is actually located in our abdomen. So number 1 would be the correct answer for the anatomy question. Again, you've got several questions that have to do with this. You have 82, and a lot of this is they're simply telling you to look at a picture and correctly identify the part that's labeled. So pay close attention, because this is one area that you could make 100% very easily, and it would help, build your test score. Medical terminology. With the medical terminology, this part of it really, the questions that they ask you have to do with ICD-10 and CPT coding. You're going to assign codes, and it's really, they're going to give you a medical term and tell you which is the correct code for that. In your study guide, however, you've got a lot of practice examples and word parts that are the most common that you can actually use to study. for other certification exams. So if you're going to take another one because a job wants you to have an AAPC certification, because you can take that AAPC, you don't have to go through a AAPC approved program, where a HEMA you do. So with this particular one, AAPC, without you being in the workforce, you can set for the AAPC and actually take that exam. This part of the certification will help you study for the terminology of that one. Terminology, there could be a definition question, a vocabulary glossary question on the test, and it is specific to what is terminology. So when they ask you those questions, they're taking the terminology to verbiage from the study guide. So please make sure you read those study guides. Terminology relating specifically to the topic of medicine or a part of medicine. So that's their definition of terminology as far as this certification goes. We also know that we have 4 parts to every medical term. We have a root word, which tells us this is the organ, that the condition that it's observing. Prefix comes before the word. Suffix is at the end of the word, tells us if it's a disease, a condition, if it's a procedure, treatment. And combining vowel is what's used to either combine 2 word roots, which is going to be O, and we always utilize those, or we're going to have a combining vowel in between a word root and a suffix if it doesn't have a vowel. Rules. Keep in mind with our rules, there is a issue as far as what spell check did for me with the rules. The very first one, when suffix is, ick, ad, and itis, or begins with vowel, the combining vowel is dropped. We don't need those because there's already a vowel attached. Words ending with ick or ac, ac, are adjectives and mean pertaining to. So anytime you see that ick or ac, it's going to be pertaining to. That's normally going to be a structure. So it could be a condition. So it could be a cardiac infarction, a cardiac infarction. It's an infarction pertaining to the heart. Keep combining vowel between 2 words, root words, even if the second root word begins with a vowel. That's for enunciation and pronunciation. Drop the combining vowel before a suffix that starts with a vowel. So again, we won't want those 2 vowels. If our suffix begins with a vowel, we don't need to add that extra one because we are going to be able to pronunciate the ending without it. Combining vowel has no meaning, so it doesn't change the meaning of the word. It just helps again with the spelling. So it connects our roots and our suffixes. O is the most common, but we can use I, and it helps to divide terms. So that's going to show us where we break our terms up. And then finally, you want to start with a suffix. You want to determine what the suffix is at the end of the medical term, and you want to read back to the beginning, then across to decipher the term, to determine what the definition is. Okay, so that is the end of the medical terminology. The next section that we'll discuss is the informational technology and web technology.